In the news, we'll be hearing about pembrolizumab in lung cancer, a new indication for Ibrutinib, positive news for olaparib in Europe, and news from the 2014 Palliative Care and Oncology Symposium. All that and more starts right now on OncLive News Network. Hello and welcome. I'm Laura Jones.
And I'm Tara Petersen.
The FDA has granted its second breakthrough therapy designation for pembrolizumab, this time as a second-line treatment for patients with ALK or EGFR-negative advanced non-small cell lung cancer following progression on platinum-based therapy. This new designation was based on the results of the Phase 1b KEYNOTE-001 study in which pembrolizumab demonstrated an overall response rate of 21% in 236 non-small cell lung cancer patients. Even more impressive, the overall response rate was 33% in the group of patients receiving the dosage of 2 mg per kilogram every 3 weeks, which is the dosage that the FDA has already approved for the treatment of metastatic melanoma. It appears that PD-L1 status is an important biomarker for response to pembrolizumab in lung cancer. When looking at PD-L1 status, the response rate was 37% in patients with high expression versus only 10% in those with low expression. Among the lung cancer cohort of the study, median progression-free survival was 10 weeks and median overall survival was 8.2 months. At 6 months, the overall survival rate was 59%.
In other FDA news, Janssen submitted a supplemental new drug application for Ibrutinib as a treatment for patients with Waldenstrom's macroglobulinemia. The application includes data that were presented at ASH last year, showing a best overall response rate of 83% and a major response rate of 64%. There are no currently approved therapies for this incurable disease. This is exciting news for patients who have this slow-growing, rare type of B-cell lymphoma. Ibrutinib was recently approved in Europe for treatment of mantle cell lymphoma and chronic lymphocytic leukemia. The Bruton's kinase inhibitor was already approved in the U.S. for CLL and as a second-line therapy for mantle cell lymphoma.
On the European front, olaparib received a positive vote from the European Medicines Agency as a maintenance therapy for patients with BRCA-mutated platinum-sensitive relapsed ovarian cancer. Under this program, it is likely that the drug will be approved in Europe in approximately 3 months. Results of a Phase 2 study showed that median progression-free survival was longer with olaparib than with a placebo at 8.4 months compared with 4.8 months. Treatment with olaparib in this setting reduced the risk of progression by 65%. Overall survival results in the analysis were confounded by a crossover from placebo to active treatment. Oddly, the positive opinion from the EMA was based on the same Phase 2 data that ODAC ruled as insufficient earlier this year. ODAC recommended waiting for results from a larger Phase 3 trial called SOLO-2, which is currently underway.
Genentech has signed a licensing agreement with NewLink Genetics for the development of NLG-919, a novel immune checkpoint inhibitor that targets the IDO pathway. Early studies in this agent have shown overall response rates as high as 36% in patients with advanced solid tumors. The hope is that the drug can be effectively combined with other immune checkpoint inhibitors, such as those against CTLA-4 and PD-1. The IDO pathway has been found to play a role in several cancers. Through the licensing agreement, Genentech has paid NewLink an initial $150 million with the potential for up to $1 billion in future milestone payments. In addition, the companies established a research collaboration on the discovery of new agents targeting IDO and a similar immune checkpoint, TDO.
In the news from the 2014 Palliative Care and Oncology Symposium, results of a study presented there showed that in a survey of almost 1,600 cancer survivors, 27% reported at least one financial problem and 37% reported a work-related hardship. Higher rates of difficulties were experienced by the majority of patients who were undergoing active treatment under the age of 65 or without insurance. In addition, female patients experienced 30% more work modification than did males. Non-white patients experienced 54% more modification than white patients and had 41% more difficulties. This was the first study to examine disparities in financial hardships across a nationally representative group of cancer survivors.
In another study presented at the same meeting, a co-rounding model that partnered medical oncologists with palliative care specialists improved outcomes for patients who were admitted to an inpatient oncology unit. The average hospital stay was shorter, and 7- and 30-day readmission rates were lower for patients receiving the early palliative intervention.
Thank you so much for watching. That'll do it. I'm Laura Jones.
And I'm Tara Petersen.
We'll see you next time on OncLive News Network.